Hi and welcome back to my channel where we talk all things lipedema. So today's video will be about surgical intervention for lipedema. So I personally have had 5 lipedema liposuctions to remove as much lipedema fat as safely possible. I'm not a doctor or a medical professional, so I can't diagnose anybody or offer any personal advice. But what I can do is share my research and my experience. So I have linked in the description below my Google Drive with any of the research I've done for this video. So without further ado, let's crack on. My video before this one, we spoke about conservative treatments for lipedema. As we've learned, lipedema doesn't have a cure and it is a progressive condition. Some people use conservative treatments to slow down the progression, but surgery is the only way to remove the diseased fat cells, which can't be lost through diet and exercise. The goal of lipedema surgery is to remove the diseased fat cells, to slow down progression and to improve the symptoms of the patient, and hopefully give the patient a better quality of life. So liposuction for lipedema is different to cosmetic liposuction. It's really important that you seek out a lipedema specialist. So the goal of liposuction for lipedema isn't for aesthetic reasons or contouring or even weight loss. I just want to plug a great Facebook group which I've used personally. I've spoken about it in a previous video, but it's relevant in this one as well. The Facebook group is called Global Lipedema Awareness Surgeries/doctors. This is the perfect group for you to join if you're looking at getting liposuction for lipedema. As it says in the title, it's global, so it covers all areas of the world. And most importantly, you're getting personal experience from patients who have seen doctors. So that's how I found out about my doctor in Germany. I researched him on the group. I spoke to women who had previously had surgery with him. I'd say that's the most important way of researching your doctor, is getting stories from other people that have had the surgery with them. A quick explanation of liposuction for lipedema. I just want to add that I'm not an expert in this. This is just through my own research. If there's anything that's incorrect or I've misspoken on, please let me know. I'm happy to take feedback, of course, because I want to be giving correct information to everybody. There's 2 types of liposuctions that tend to be used on lipedema patients. A vaser liposuction breaks down the fat inside the body and emulsifies with liquid. Then the emulsified liquid is removed by a cannula. Tumescent liposuction injects fluid which softens and numbs the fat cells. Then a cannula is used to remove the fat and the fluid. Compression garments after surgery are a #1 essential. Your surgeon will advise you how long before you need to wear your compression garments and how long after you need to wear your compression garments. So my surgeon recommended compression before surgery, and after it was 8 weeks for 24 hours a day. Okay, so now it's side effects of surgery. Yes, so surgery is not an easy option. So the most common side effects, which most of you will experience, if you don't, you're very lucky: bruising, swelling, pain, numbness in the area where the lipedema fat has been removed, and burning sensations. Less common side effects include fatigue, infection, dizziness due to low hemoglobin or fainting, constipation, blood clots, and dehydration. Obviously, with such a big invasive surgery, there are other side effects. This isn't an exhaustive list. I wanted to do something a little different, and I wanted to reach out to my Instagram friends and ask them about their personal experiences with surgery. I asked what they wish they'd knew before their surgery and anything they'd do differently. At Less Lipedema said they would ask for stronger painkillers. It's very important to be comfortable during recovery as much as possible. Don't be afraid to take pain relief. Just remember, you won't be on it forever. It's a very intense, difficult period. I'd say 3 weeks after surgery. At Plus Size and Proud also mentions pain and says that they wish they'd known how bad it would be. And they've also mentioned taking a stool softener. Being constipated is an added discomfort that you don't need. It tends to be the general anaesthetic that causes constipation. As I've previously said, it's a difficult recovery anyway. So if there's any way you can make it easier by taking medication to deal with any of these side effects, then do it. At Living with Lippy says that they wish they'd spaced their operations out more. When I first was researching my surgeries, I noticed that people were having surgeries 3 months apart, but it's not always doable. Personally, I was having high volume removal, so 3 months apart wasn't doable physically. At Lipoedema Facts says they wish they had known how low haemoglobin would have affected them, so they'd have gone to the hospital sooner. Low haemoglobin is gross. I had buzzing in my ears, I couldn't stand up, I could feel my heartbeat in my neck and my chest. If something doesn't feel right, get checked out. Don't always assume that it's normal after surgery. At Lipoedema Facts also mentions airport assistance, as well as Lipoedema Lizzie. This was such a good point. If you're travelling for your surgery, I'd definitely recommend booking airport assistance on the way home. The last point was from a few people, including Annabelle Rose Williams. They wish that they had researched the surgeon more and the type of aftercare they provided. It's so important that you have good aftercare. You still need medication, pain relief. If you've got low haemoglobin, you need that support from a surgeon. Okay, so that's everything for today. Thank you for watching my video. If you could like, share and subscribe, that would be great. If you want to connect with me on Instagram, my username is @fat_bottom_Amy. And I hope you'll join me for my next video. Bye!